Hello and welcome to Healthcare Matters, the internet television program that explores the intersection of medicine and the law. I'm your host, Mike Matray, and today's guest is Dr. Richard Anderson. Dr. Anderson is the Chairman and Chief Executive Officer of the Doctors Company, the nation's largest physician-owned medical malpractice insurer. Welcome to the program, Dr. Anderson.
Thank you very much. Nice to be here.
You live in California, a state that instituted the Medical Injury Compensation Reform Act, or MICRA, in 1975. It's considered the gold standard of medical liability tort reforms. As a result of MICRA, California has some of the nation's most affordable medical malpractice insurance premiums. Can you walk us through MICRA and what are its most effective provisions?
Yes, absolutely. So MICRA has four provisions. The by far the most famous and the single most important, although all are important, is the $250,000 cap on non-economic damages. So I hasten to add that there is no cap in California on total damages. So all true economic damages are 100% compensated. But pain and suffering is limited to $250,000. And that is a really fundamental reform. And in my mind, it actually increases the equity, right? Because what we're saying is everyone, rich or poor regardless, will get the same pain and suffering award in a serious medical malpractice claim. We're not going to try and figure out if some person deserves more or less for the same kinds of injuries. So I actually believe it increases equity. But be that it is may, it is the single most important reform. And the reason why it's the single most important reform is that if you don't put in a cap on intangible, non-economic damages, pain and suffering, effectively that goes to infinity. In other words, a sympathetic enough plaintiff can easily convince a jury award that the pain and suffering should be $100 million. Heck, it could be $1 billion. And so those kinds of numbers are almost impossible to insure. It only takes one or two $100 million non-economic damage awards a year to bankrupt smaller insurance companies and to bleed the entire system. So it puts some stability in the insurance system and the insurance mechanism, while yet promising 100% indemnification for actual damages. So that's number one. Number two is periodic payments. If an award is to be made over the lifetime of a patient, then the award, for example, an award made to cover the lifetime of care, then the award is paid out over a lifetime. So that works to make even large judgments more affordable. If you have a $100 million judgment, but you pay it out over 30 years, the annual cost is less than a single hit of $100 million. So periodic payments is important. Collateral source is number three and also very important. And collateral source is confusing sometimes, but really my explanation of it I think is pretty straightforward. Collateral source says there really shouldn't be double dipping. If, for example, you already have health insurance and the cost of your health care has already been paid for, then you shouldn't collect for it twice. So collateral source means no double dipping. And the other is a limit on attorney contingency fees. Right now, around the country, the average attorney contingency fee in professional liability cases is somewhere between 30 and 40% and as high as 50%. But those are huge fees going to an attorney. What California does in MICRA is it says if you as a plaintiff's attorney win $1 million claim, your fee is limited to $221,000 plus all your expenses. $221,000 plus all your expenses. $221,000 plus all your expenses for $1 million claim, it's a nice day at the office. And what it does is it keeps the money in the healthcare system, and more importantly, it keeps the money in the pockets of the person for whom these indemnities are designed in the first place. In other words, Instead of putting 30 or 40 or 50% of the indemnity into the pocket of the plaintiff's attorney, we're saying that no more than 21% on $1 million claim, 22% on $1 million claim can go to the plaintiff's attorney. So where does that money go? It goes to actually the injured party. So those are the four cardinal tenets of MICRA.
Would you support a federal level legislation similar to MICRA? And if so, what's the likelihood of getting such a federal act to pass congressional scrutiny?
Well, so the answer, I would say 100% to your first question. I support it 100%. Likelihood, 0. I wish it would be. We really should have a federal standard. Again, we get into states' rights issues, and we have all sorts of other related issues. Medical licenses are state-based. Medical litigation is state-based. The only time you have federal medical malpractice litigation if the federal government itself or a healthcare provider employed by the federal government is a defendant. So it's not generally a federal issue. At the same time, standards of care in reality are national. And that's number one. Number two, in this era where we have large medical groups that practice all across the country, or alternatively, we have patients who are entirely mobile. I mean, the notion that if you grow up in California, that all your medical care is going to be in California is completely untrue, even if you still live in California, because you can be traveling anywhere in the country at any given time. So it makes a whole lot of sense to have federal tort reform litigation, and certainly federal version of MICRA would be a very welcome reform to the entire system.
Dr. Anderson, thank you for taking the time to visit with us today.
Well, thank you very much. It was a great pleasure. Thank you.
Medical malpractice claims frequency is at an all-time low, and the medical malpractice insurance industry has been experiencing its longest soft market in history. Are further tort reforms necessary if claims frequency is at an all-time low and the cost of medical malpractice insurance is stagnant? And if so, why?